Everyone wants to take their business, their skills, to the next level. Small and mid-sized business owners have exceptional insight into how to do this. They endure and thrive because they find ways to overcome the challenges that come their way, and they can teach us valuable lessons to apply to our own companies and lives. Stephen Nooner, founder and owner of Alkali, a company with a unique process that helps businesses more effectively buy and manage their insurance programs. And Bob Gibbons, builder of Riata Commercial Realty, a real estate advisor and tenant advocate, are two prominent Metroplex businessmen who, along with their weekly guests, will ask their and your probing questions, finding impactful solutions that will help you reach for the next level. Here are your hosts, Stephen Nooner and Bob Gibbons.
Welcome to the Next Level, conversations that propel business. This is Bob Gibbons.
And this is your other host, Stephen Nooner. I'm a little disappointed that you didn't do your radio voice. You promised a radio voice to our guest today.
But what happens when I don't have a radio voice?
We'll harmonize our voices there. Michael Walsh, CEO of Cariloop, is here with us. Cariloop provides dedicated support for employees that are trying to take care of people they care about. We're going to learn a lot more about
whatever you said.
Nice. That's not what their website said. Dedicated support for employees caring for loved ones. Mm-hmm. They've recently been named to Tech Week's 100 Dallas Tech leaders and 5 fastest growing on TechCo Celebrate Startup Competition. Boy, I'm just killing it.
Man.
You should have done the radio voice.
I'm going to hire you for the commercial that we do.
So,
you were worried about a voice. I'm worried about coherence.
They have 10 employees. They're based here in Dallas. If you want to learn more, please visit cariloop.com. That's CARI loop.com. Welcome.
Thanks. Good to be here with you guys.
Well, we always like to start the show off with wisdom of others, and we usually have a quote from somebody brilliant, or at least more brilliant than we are, or at least Stephen today. And this week's quote comes from Arnold Schwarzenegger. And Arnold said, "I wasn't there to compete. I was there to win."
Amen.
I like that quote because, I mean, he had a very specific goal in mind. And this, of course, referred back to when he was a bodybuilder. And he was going to
8-time Mr.
Olympia.
Universe, in
Olympia, wasn't it?
Yeah.
Anyway, I just thought that was a cool idea because, I mean, competing, who cares about competing? In his case, he wants to win.
Yeah, we're all competing, right? We're here to win.
Well, yeah, I mean, we're competing whether we know it or not.
Right.
And we sometimes don't even know who our competitors are.
Sure.
Or at least we're blind to that. But if we're there to win, then who cares what the competitors are doing?
Let's win, Bob.
That's why.
Fist bump.
You in, Michael?
Let's win it, guys. Let's do it.
I think you should change your website. Just say winning.
Win it. Yeah.
Okay.
I'm going to consult with Steve on all of our website design.
Yes,
from now on.
well, I'll do better that than audio.
Yeah.
So why don't we, back into this? So where did the idea come from? How did you guys get your start?
Yeah, it's kind of a 3-part story. So I had a personal experience with caring for a loved one. It actually wasn't me doing the caring. I was kind of the secondary caregiver. So I watched my grandfather had some serious heart and brain issues back when I was in college. And I watched my mom pretty much disappear for 6 months. And even though I was busy with school, I kind of had to step into the role of, helping out. I've got 4 younger siblings, a dad that's running a company, so I kind of saw firsthand from a young age what it's like to be in this position of you get this news, something's wrong with, a parent, a grandparent, a spouse, an in-law, something like that. And, how do you handle it and what do you do? And then fast forward to when I started my career at a firm up in Chicago called Protivity, I saw a lot of my hospital clients were really scrambling to try and figure out, like, how do we, when we discharge a patient and send them back out into the world, how do we help the family? Like, what do we do? What do we give them? What resources can we provide? And when the Affordable Care Act got signed, all of a sudden now there's like legal and financial ramifications for if those patients end up back in their care. Mm-hmm. It changes the whole reimbursement structure of it. So there was a really cool opportunity we saw for us to come in and try and solve the problem. While everybody's trying to figure out how to help those patients, we've taken the angle on how do we help the caregivers of those patients. So again, anytime you're in this situation where you've got Alzheimer's, Parkinson's, cancer, you've got hips and knee issues, it doesn't matter what it is. It could be cerebral palsy for an adult child. Like, whenever you're a caregiver, how do you get through it? Because let's face it, you've got full-time jobs. You've got all these different activities you're involved with. It's hard. It's a lot of time. It's a lot of stress. So anyway, we saw the opportunity when all this got done in Washington, D.C. to really make a splash, make an impact on the lives of caregivers. 1 out of every 5 of us now in the workforce is caring for somebody. And most of those people are Googling their way through how to do it.
Thank God for Google.
Yeah, like so we just, it's that stereotypical, there's got to be a better way type of mentality that entrepreneurs have. And so me and my co-founder, Steve, we've been buddies since we were kids. Decided that we were going to take this on, and we've been doing it for the last 5 years.
And you guys had some other projects you were working on before, because this was a bit of an evolution for you guys, right?
Yeah, so, well, and just in terms of how the product evolved, right? I mean, it started off as a completely different thing. The original idea for all this and how to solve some of the pain was to build, if you're familiar with OpenTable,
oh, yeah.
for restaurants,
sure.
you go online, you book, you can see the open tables and make a reservation. The original idea was, let's create an open table system where we can put assisted living and nursing home bed data into a platform and send that data into hospitals so that the discharge planning staff, the social workers, can better tell the patient and family, we know there's an open bed at this place. It matches up with what you need. So that was the original idea. Steve came up with this idea. We started working on it, and then it evolved into, well, wait a minute. It's not just assisted living and nursing homes. It's much bigger than this. And it's not just seniors. It's everybody. So let's make it more about just providers in general. Let's walk caregivers through a series of steps, and we can then match them with the right types of provider, not just a facility, but a home care provider, hospice, anything like that. So it evolved into that, where when we built this product, we launched it in 2014, and it was really cool. It would match you up, kind of like a Match.com or the way dating sites work nowadays. You could see how you match with certain providers.
Do you swipe left or right for them?
No, not yet. This was before the swipe. The swipe process was born.
Why do you know that? Bob?
Yeah, exactly. That's what I'm wondering.
Because I have kids in their 20s.
So it became that. That was kind of the second evolution of this, second piece of this, and then from that we discovered that now when caregivers are trying to answer the questions, many times they don't know the answers. So we couldn't even get them through to the end of the process to match them. And so we said, okay, let's back up a second. People, when they're going through this, they're confused, they're stressed, they're trying to manage everything in life. They want to talk to somebody. And at the same time, the last few years you've seen, and I know, Steve, you've seen this in the industry, all the growth in telemedicine. And this feeling, this user experience they've created where you can talk to a doctor on a video chat within 15 minutes, 30 minutes. So we said, why don't we create that type of experience instead, where when you're in this moment, you're trying to piece all this together, let's get you on either video chat, phone call, or online chat with a nurse or a social worker who's completely dedicated to you. At any time you're dealing with an issue or a challenge related to caregiving, they're there for you. And so, the third step of all this then was creating that service, but then building a technology application behind it where it's just as easy to access that person as just tapping a button on your iPhone, and they're right there with you. Cool thing about it is then you can also include your family members as well. That's part of what the app does. It brings the whole family together and really rallies them around the coach that we give you.
So does it create like a page for that person that
exactly.
has a need, and all the caregivers are sort of a part of that?
Exactly. We create a case in the system for, let's say you're taking care of your mom, and you and your 2 brothers are trying to solve for this. We get you, your brothers into the platform, create a case for your mom, assign you a coach. All the communications, files, documents, all the stuff you're passing back and forth is all there, organized. And anytime you need your coach, you just tap the button.
Are the service providers on that platform as well, or
no? Actually, so part of
HIPAA would be a problem for that.
Well, I mean, yeah, it's something we definitely look at in terms of security and privacy. But what we've learned over the course of time with all of this is that we really want to make sure that the recommendations we're making are customized to the family. And there are so many factors at play, the finances, the insurance, the location, the services and amenities that a provider might have, the inspection reports, the management tenure, just all these things. And so our coaches actually have a very curated process for evaluating provider options for our members. And so we go secret shop them, we interview them before we even put them in front of one of our members. It's a very detailed process. It's not just here's a database or a directory of places, go check them all out. We're actually going through the steps of, we think based on everything you're telling us, these are the best doctors, specialists, or providers for you to look at.
So other than the great intro I gave you at the beginning,
It was masterful, sir.
how do you guys move? How do you guys move your message? I mean, like you got a new product, a new solution in the marketplace,
Right.
at least from what I've seen. How do you get in front of the decision makers and get that moving?
Right. So again, you briefly mentioned that we've chosen to go to market with this product through the employee benefit and health and wellness channel. So the message we've been taking to employers and organizations is exactly what I said before, that 1 out of every 5 of your people, whether you realize it or not, is going through this right now. And a lot of times that message immediately resonates with them because they've been going through it. Most of your decision makers in an organization, it's HR, benefits managers, or your executives, they tend to be in that 40 to 50 age range. So you've almost got, at least by our calculation, a 50-50 chance that they've either gone through it or they're going through it now. So immediately that emotional resonance comes out and they're like, oh, wow, yeah, you're right. Like, this is a thing. This does take a lot of time and a lot of money. So if you can start from that place where they understand the pain of what an employee goes through and then talk about the economics of the model and what the value is in terms of engaging the employees there and what we could do, we're getting the message across very well. It's been fun to watch the last few years with this really sort of, again, piggyback on telemedicine and evolve. We're seeing more and more employers now are really excited about not just employee wellness, but well-being. Like the whole person, not just their physical health, but their emotional health, their financial health, their spiritual health. We fit great into that. So, I mean, the trends have been very favorable for us to go and introduce this product. And you're right, we hadn't seen anything like it in the market before. So that's been one of our biggest barriers, is just introducing the idea.
So you're a pretty new company. So what has been your growth rate then? I mean, what's your adoption?
Yeah, so the first year we went to market was mid-15, and I mean, we had our first couple companies sign up for it. I think we signed like $25,000 worth of contracts in the first year. Over the second year now, we've done about 6 times that. So we signed up about 150,000 contracts in year 2. And I think for this year, year 3, we're projected to do about 8 or 10 times then. Year 2.
Nice.
So we're looking at somewhere between 1 and 1.5 million in contracts this year we're going to sign.
So your channels, you said, were through the employer benefit modes, but what if
Right.
somebody's not employed or not covered by a group plan? Do they have access to the program?
Absolutely. We don't market it as much. It's not something that we're running Google ad campaigns out there for. We tend to rely on when an employee uses it, they go to church, they go to, a sporting event, they're, with other parents of their kids, and they talk about it. And then we like that word of mouth referral a lot more than paying for clicks or ads.
Sure.
So yeah, you can come sign up. It's $300 a year for a membership. It's really easy.
But at that price point, if you were directly going after that business, aren't you going to be selected against? Aren't you going to find people that are going to pay it because they already have something going on? And then is that really profitable, scalable at such a great fee?
Yeah, I mean, we're definitely, we've only been doing this for a year with that B2C model. We are already seeing there's no price sensitivity at $300. So we imagine the price of that's going to go up because the service is just such high quality. But you're right. I mean, it's definitely one of those things that more and more people will talk about.
For the employer, it makes sense, right? It's like you have the law of large numbers. You're going to have some people at any given time having it, not everyone using it at once.
Right, exactly.
All right, well, we're going to go to a break. Before we do, how does a caregiving company create a toxic culture? Stick around as we learn from how Michael grew from his mistakes.
And now, Confessions of a Recovering Landlord.
This is Bob Gibbons with Riata Commercial Realty, and I am your recovering landlord. After 20 years as a landlord, I now use that experience only for the benefit of companies that lease or buy office buildings and warehouses. Today's confession: knowledge is power. We all negotiate from a position of power and strength, or at least we want to. In any negotiation, the party with the most knowledge probably has the upper hand. And landlords count on this being the case whenever you're negotiating a lease, because most landlords are professional real estate investors and they hire professional leasing agents and property managers. Landlords are in the market every day negotiating leases, while tenants probably only negotiate 1, maybe 2 leases every few years. So tenants feel outgunned. Don't let landlords have all the power. As a former landlord for 20 years, I understand how landlords think and what motivates them. So let me put that knowledge and experience to work on your side of the negotiation. To learn more, contact me at texastenantrep.com. Again, that's texastenantrep.com.
Have you started making plans to take your business to the next level in 2016? Hi, I'm Stephen Nooner, founder and CEO of Alkali. We have a trademark process called the Empowered Advantage that enables CEOs, business owners, and entrepreneurs to more effectively buy and manage their insurance. Before sitting down to make your plans for the new year, here are just a few things to consider. Would you say that you have an actual insurance strategy, one that you can articulate, or have you just purchased a policy here and there over the years? If you have an insurance strategy, was it discussed under the pressure of a renewal deadline or considered earlier in the year to avoid fire drill decision making? If your answer was no to either of these questions, then you may not have the right partner on your team. Visit alkaliservices.com to contact us and take the next step to a bigger and better future.
Hey, I'm Zane Conkle with Citracom, and we are a voice over IP provider providing phone services to businesses across the country. I wish I could put Bob and Steve on hold here for a while.
Welcome back to The Next Level. We're here with our guest, Michael Walsh, CEO and founder of Cariloop. You can find more about them on the web at CARILOOP.com.
What a great reintro, Bob.
Yeah, boom.
Isn't that nice? I mean,
Beautiful.
I actually was able to do that without stumbling all over myself.
Super great.
Unlike our original intro. Hey, so 2 years ago, Michael, I had my father die and my mother-in-law die all within about 7 weeks of each other. We had dealt with hospice and in the hospital, and it totally affected business. And I mean, there was all kinds of stuff. Yeah, I mean, I wish I'd have known about you then, honestly. But my question is, this was out in a rural community south of Fort Worth. So it's sort of part of the Metroplex, but it's a little bit out off the beaten path. So what's your geographic coverage? Are you everywhere in the country?
Yeah, it's funny. We had our team meeting this morning, and my coaches were running through. I mean, they're helping families find facilities, and I think Fort Myers, Florida, and some small town Connecticut were two that they mentioned today. Like, because of that process I mentioned and the curation we go through, yeah, we can do this anywhere. I think we've even done it in Canada. Yeah, it's because this isn't telemed where you're prescribing medication or providing medical care. We're coaching. These are social workers that are really helping to navigate the system. It's the same issues no matter what. Where it gets local is just helping find the right doctors or providers, and we do the research.
How much coaching are you doing? Because I got to imagine there's a lot of like emotional baggage that gets into these deals. I mean, I'm hard pressed to find a parent-child relationship that doesn't have some strain already.
Oh, yeah. And in fact, one of the things I can tell you from personal experience is one of the regrets would be the sort of, I wished I hadn't cleared up a few things. I wish I had cleared up a few things before they were sort of too far gone with Alzheimer's, for example, to really address it. You know, and at that point, it's not fair to have that conversation because they're not equipped to have that conversation.
No, I mean, and this is part of our key messaging, actually. We talk about that our job is to help families to plan for and manage the care of their loved ones. And that's where people oftentimes, they drop the ball, is to plan for. There was no plan. Something happened, and now we're scrambling to figure this out. So we see a lot of that, but back to your question before, Steve, about how we're going to market, like we're trying to push that message a lot to the employers and the organizations we work with. Is we're not just here to solve for when the employee's dealing with an issue. Let's help them get ready for the issue. Let's get them organized. Where is mom's insurance paperwork? Where is her medical POA? Where is her insurance card? So that if something happens, we're a tap of a button on an iPhone or an Android device away.
Would you provide coaching though? Like, so I can imagine some of those conversations because I've tried to slightly broach them with my parents. Like, why do you care? What is that? You know, do you all provide coaching around that?
Yeah, absolutely. That's why you bring a lawyer or a financial advisor in a lot of times, right? It's an independent third-party professional.
Sure.
That if you want to be angry with them, go for it. We tend to have to manage a lot of the family dynamics at play here. That's right where the coaches are fantastic at this.
'Cause, I mean, it's crucial too, because for me, it's like people don't realize. I think a lot of times these things impact like 3 generations. So it's like, oh, Bob's business dips, and so he's not able to put as much money in retirement. So now he's that much more like likely to need to lean on his kids. And, you know, and then they are taking care, and then.
Or what if Bob had to pay for mom's
grandkids.
care? Or, you know, like, yeah, you're right. It does send a reverberation effect through the whole family when this happens. If you're not ready and if you haven't taken steps, it can be, debilitating.
So let's switch a little bit to the management of your company, you know, and the building of that company. So I want to talk about the personnel. How do you recruit these counselors, and are they physically in your office, or are they sort of distributed throughout the country in their own office, their own homes, or what?
Yeah, I mean, we're all here in Dallas. The coaches, we call them coaches. They're mostly social workers, nurses, case managers, therapists of some sort. But we have a certified assisted living manager as a coach. We've previously had nursing home administrators. We're looking and interviewing a couple of therapists, physical therapists, speech language pathologists. They have to be a licensed or certified healthcare professional with at least 10 years experience to be a coach. We also then have assistant coaches that help out a lot with the research, the phone calls back and forth, some of the behind the scenes stuff. And those folks, they don't need to have specifically the licensure or certification like a coach would. But
And are these people full-time? I mean, this is their only
full-time
job?
employees. That's a big
Oh, wow.
differentiator too.
I figured this would be a great opportunity for them to sort of do something on the side.
We tried that. Back to your question about building the model. We tried contractors, and if we want to have the 1 hour or 2 hour response times and create that level of accessibility for a member, you can't have contractors. These people have to be ready. As soon as something comes up, that coach sees it on their dashboard and they're jumping in and getting to work.
Because it's always the same coach.
Correct.
That's the
same.
problem, I guess. So what if I have a problem at 2 in?
Well, at 2 in, if you're going to post a message about something, your coach is going to see it first. If it's really a problem at 2 a.m., call 911.
Oh, yeah.
It's probably a medical problem that something's wrong.
Okay.
No one's looking for assisted living facilities or trying to answer questions about Medicare at 2 o'clock in the morning.
Gotcha.
But we've had members post pretty late, and as soon as the coach gets up in the morning, they're jumping right in.
Gotcha.
So you talked about the technical skills. Mm-hmm. I would imagine to do what your coaches do, you have to look for a certain type of culture and profile, right?
Yeah, I mentioned some of this story early on about what we were when we started. That it was all tech. There was no touch to this whatsoever.
Okay.
And I tried to run the company that way, very efficient, to the metrics. I really left the people and the human factor out of the equation.
Sounds kind of cold.
It was, and that's actually how the technology felt when you went through it. I gave no consideration whatsoever to the user experience. It was all about just pushing people through a funnel to create revenue. Like I was trying to build a SaaS product out of this, and I completely missed that. And so I ran the company that way. So the first few people we hired, I gave them unrealistic goals and gave them expectations that there was no way they were going to be able to meet, because I had never even done it yet. Like, how can I expect them to come in and do their jobs well and know what tools to give them to be successful if I haven't done it yet? So, yeah, I nearly ran the company into the ground those first 6-9 months. But thankfully, we made some adjustments.
How did you know to make those adjustments? Who told you?
Well, I actually have to give some credit to our chief service officer, Jaren. Her and I really bonded over, I think I shared this with you guys, a book called Leadership and Self-Deception by the Arbinger Institute. Have you guys read this book?
No.
It's all about how we look at the world and how we treat each other. And it's about treating people like people, not objects. Instead of using people as tools, actually looking at them and trying to really make them successful. How can I make them successful? So it just completely shifted my whole paradigm on how this should be run, and how the brand should feel. And when people look at Cariloop, what should it be? And it's got to be a human-powered technology company. It's got to be about service. It's got to be about people. So, yeah, I nearly destroyed this thing.
So what did your employees think when you walk in one day and all of a sudden you're touchy-feely instead of Mr. Cold?
Well, it was kind of it wasn't that quick. It was kind of a slow burn there over the course of 90 days. Like a few of the employees ended up resigning. It got down to pretty much me and Jaren, and we just got together and had some hard conversations about where this was going, and brought some new people in, and we spent an entire Saturday, I can remember it, end of September of 2014, just on a whiteboard, a bunch of us reimagining what this could be like. And we walked out of there with a lot of clarity around what we needed to do. And over the course of 6 months after that, we executed and we completely rebuilt what it was. So that's 2 years ago now.
So you rebuilt. So what do you do though? Like an ongoing basis, what are some handles for someone who maybe needs to learn from this?
Well, I think you've got to actually establish what you want your culture to be about. What is the definition of it? Why do you exist? And everybody at the company needs to know why you exist. So every Friday morning we have what we call a celebration meeting. We celebrate the wins for the week. And every week we start off with someone from the team reciting our why statement. Why do we do this? Why are we even here? And that's because we believe no one should go through the process of caring for their loved ones alone. Everybody knows it. So it provides a lot of, focus every week around why am I getting out of bed? Mm-hmm. And everybody really has bought into this idea. And so it really provides a lot of clarity then for your job as far as what I'm doing. And if it doesn't get you to that goal of helping people not go through this alone, then it's not important. So I think defining your culture, why you exist, and then really helping the people that you're hiring understand that you're there to help them be successful. Because if they succeed, the company succeeds, not the other way around. They're not objects, they're people. So I think those are important lessons for any young company, especially as you're raising capital, you're growing quickly. It's easy to deviate and get off course and just start hiring people and throw them into the machine, and hopefully it creates a result. Like, you got to actually stop.
So speaking of capital, how have you funded this company?
So we actually graduated from the Health Wildcatter program here in Dallas in 2013. We came out of that program and we raised a $500,000 seed round to get started. That's where we built that Match.com, Hotels.com kind of.
And what kind of investors did you have?
Mostly angels here in Dallas. We actually raised almost all the money here in
Through
Dallas.
a formal angel network of some sort?
No, these were just individuals. A lot of just individual check writers and groups that just had gotten together and wrote one big check. So we raised $500,000. About a year later, we raised another $500,000 convertible note. And over the last 90 days, I've now raised like another $825,000. So we've raised just over $1.8 million over the last 3 years to fund this.
And what's the benefit of a convertible note versus just stock?
It's not a pure equity play. It actually goes on the balance sheet as debt, but then there's some sort of triggering event in the future, either a future capital raise or a big contract of sorts where it converts to equity. But it converts at a discount to the next round. So let's say we price it at $10 million, maybe it converts at $6 million. So the people in the convertible note get a little bit of a discount on the price. So that's also been a learning process. We could spend a whole show talking about just that.
So what's the quickie sort of best practices, or from the founder perspective, what is it you want out of an angel?
Really someone that understands why you exist and can help open some doors. Anybody can just write a check and walk away, but establishing clear expectations with these guys, like what do they bring to the table? Why are they excited about it? These are now business partners of yours. So you better understand what their intentions are. And if it's just because they're wanting to place a bet on you because they believe in you, then great, you know that up front. But I think having some good strategic people involved that can really open the door for you, that's really what you want to look for.
Well, thanks so much for being our guest today. We really appreciate it.
Yeah, thanks, guys.
If you want to learn more about the company, please go to Cariloop.com.
Cariloop.com.
If you want to know more about the show, please go to nextlevelshow.com or go to iTunes and type in The Next Level Show, where you can find us on podcast. And
THE.
And check out our archive. And we had Jeff Whittle on the show at one time. He's a recovering lawyer. I almost said landlord, because that's what I am. So check out that, and we will see you next week with another great guest.
Have a great week.
You have been listening to The Next Level, Conversations That Propel Business with Stephen Nooner and Bob Gibbons. Join us every Tuesday at 1:30 p.m. for more prolific conversations that will take your business to the next level.